So I was having a lot of issues with my weight and everything. Obviously, internal bhi hota hai, but then I was having issues with thyroid, and then I used to get really tired very quickly. And my job, I spent 12 hours in a day, so my knees were getting affected as well. I tried to get information, and I'd heard about you before, but then when my husband met Dr. Sheetal, that's when he decided. I was having issues with, obviously people think that, oh, is pregnancy going to get affected by this or something like that. But I know that that's not what happens. And it's gastric sleeve, it's not bypass. Because I was looking into bypass and gastric sleeve, and I feel like gastric sleeve would be a better option for a person like me. But Mako, I just thought that it was मेरे को पहले शुरू में डर लगता था anesthesia से भी. वो तो होता है normal human brain that thinks that okay, what's going to happen with that. Other than that, वो surgery के बाद की pain and all that kind of stuff, I just didn't know if I was ready or if I was ready. I just went back and forth. Surgery के time पे everyone thinks that. You go back and forth so much. But when I made the decision, I was like, I'm going to go for it. And you need to have a good doctor as well. And when we researched you as well, everything looked great. You've had so many good reviews, so I really like that.
So what about the post-operative discomfort? Was it as much as expected? Or?
No, it was actually less than expected. First day it was bad for me. I don't remember much. I was under anesthesia anyways. So, but with the pain medications and stuff, the staff was very good with that too. So I was very happy. Second day I was actually moving around. Normally I didn't have any issues. And today this third day, fourth day actually. Fourth day. Yeah.
You can say third day. The zero is the
So I feel pretty good. I can now that my hands are free as well. Why now I can actually. I'm happy to do something by myself. But even
you're feeling any changes in your body?
I feel light because I'm not eating. But I was feeling energetic today when I was walking. Even though I haven't had anything, I was feeling weak in the morning. I had some water and then I walked around and I was feeling energetic at that time. Headaches mujhe hote the rose. I have had headaches every day. I have to take medication for that. I don't know what it is, but after the surgery, I haven't had headaches since about 3-4 days. So it's weird to me. I swear to God, this is so weird to me that I haven't had headaches since the change. I'm excited for the changes now. When the lightness is going to come, then it's going to be better. Even breathing wise, मेरी नाक हमेशा खुल और मेरे को गले में भी ना बलगम सी रहती थी हमेशा. And that was because I used to have gastric issues like acidity and stuff like that. And the doctor said, no, okay, don't do caffeines and stuff like that. But अब मुझे ऐसा लगा जैसे मेरे 3 दिन से कुछ feel नहीं हुआ वहाँ पे. So that's one of the things as well. I'm going to work out as well. I'm definitely going to incorporate exercises into it. I'm not just going to... I just surgically the choice. I'm definitely going to incorporate exercises and stuff.
It will help a lot.
So I can get the maximum out of it. Once you've taken the step, you want to get the maximum out of it. So I think the initial 3 weeks are hard when you're adjusting to the liquid thing. Otherwise, I think... अभी तो 1 हफ्ता होने ही वाला है, so
this looks pre-surgery, it looks very difficult, but once surgery is done, your body is helping you do it.
Yeah.
Initially, if you start doing same thing before surgery, your body will never allow you to do it.
Yeah.
Because the size of stomach is more, it demands is more. Right now, demand is not there.
Yeah.
It is whatever we are forcing you, you must take.
Yeah. If I was doing this by myself, saying that, oh well, let's go on liquid diet. Even if I would have done it for 1 day, I would have started binging the next day or the 3rd day. I wouldn't have gone through with it. Now that my body is different, it's telling me I don't feel hungry. I don't feel that hungry. Abhi bhi ye log mere samne kha rahe the and I just was like, okay, that's fine.
You are also a doctor. What do you have opinion about this surgery? Because many doctors have also many hitches about this.
Yeah, of course, everybody has issues. I think for my daughter case, she was not willing to do it other way. So like dieting or exercises, she's not that strong willpower she has. So we were forcing her, but actually the issue is
the stomach size has been more.
Yeah. And
If you want to, you cannot do it.
initially we were telling her to do the other things, and then it should be your last option.
Yeah.
Since it's a surgery, you are getting your stomach cut down to half or whatever size, 80% you took out, right? So we were initially, I was not in the favor of getting this surgery
Yeah,
done.
he was against it
Yeah.
so much.
Yeah, so, but right now it's done, and then I think she will follow the protocols and get rid of all the weight. And of course, you have done a good job. I'm going to recommend you. If I stay here or in the US, I will refer all the patients to you. And
Yeah.
I'm
Thank you.
thankful to you
Thank you, sir.
and doing a good job for my daughter.
Yeah, because initially I was so scared कि बाद में क्या होएगा, but now I feel good today. Like the tube's out, everything is out. I'm
You
feeling
can
pretty.
She didn't have any complication or anything. We were worried about what will happen after the surgery, but you have done a good job. She didn't have any complication because the first 2 or 3 days are critical. Crucial. So, but she has gone out of it, and then now I think she will do good.
Now
and
just she
lose
has to
weight.
follow us for another
Yeah.
3 weeks, total 3 weeks.
Yeah,
After that, she is as good as any of us.
yeah,
Mhm.
exactly. So 3 weeks, so I'm gonna take full precautions, and then I'll come and I'll meet the dietitian as well. उससे भी फर्क पड़ रहा था कि dietitian से भी when we get the whole, she gave it to me for a year, which is really good. I'm gonna try to follow it as much as I can, so that I can get the best result out of the surgery.
We're going to get it done.
Yeah. So when I come next, hopefully you'll see half of me. So yeah, I'll be back in a few months.
Okay. When are you traveling back to US?
I'm thinking first week of June. Is that okay to
That's
travel?
fine. Perfect.
Yeah.
By the time you go, you will be losing 10, 12 kg.
Yeah. No, I'll come see you before that, obviously. So, exercising wise, can I start exercising or not
You
walking?
can start from tomorrow itself.
Okay.
Because just you have to take care that this doesn't get wet with the
Yeah. No.
She can shower, right?
She can shower
but
the
don't
you-
rub and all those.
Yeah, I'm not gonna
Because-
rub it or anything.
But
If you can avoid getting that wet, it is okay. Otherwise,
Yeah.
all these are wet washproof,
Yeah.
except the one.
Right.
If that gets wet, you can change it yourself at home.
Yeah.
Okay. And then I come when do I come back for a checkup?
Today is Friday.
Yeah.
When
Wednesday. Okay. To get this
will
stitched
take out
out.
all the
Okay. Sounds good.
If any other precautions she has to
I
take,
think it's no weight
except
lifting for
those
another 2
protocols,
months.
yeah, that's
No weightlifting,
Yeah,
yeah.
that's for
And
all
how
the
much
surgeries.
weight can I?
4 or 5 kilogram is okay.
4 or 5
Not
kilograms.
taking up the bucket or
Don't
something.
take
like
anything
that.
for some days.
Yeah.
That's fine.
2, 3, 4 kilograms. is nothing.
Yeah.
Yeah. Only purse.
Too much.
You can carry the purse.
Yeah.
That's it. No more.
Yeah. Yeah. No, my husband was very happy as well. He was telling me too. Because he's the one who knew this doctor, and then we met you. And our friend Dipanshu, you did his surgery as well. That was a different surgery. Dipanshu's, and you know what he told me? Dipanshu was like, if your surgery goes well, I might go into it. You know Dipanshu, he's heavy and stuff.
Ah, yeah, okay.
So,
Dipanshu also wants it.
yeah, he was telling me, he was like, if it goes well, maybe I'll go into it. Because he also keeps trying to do fad diets and all that kind of stuff. And he's always on lemonade diet and stuff. But abhi fir hum usko bol rahe the ki, he was telling me, he came to see me as well. He was like, agar tera acha gaya, then I'll get it done. Chalo. So, let's see.
Okay, thank you.
Okay, thank
All
you
the
so
best.
much, doctor.
Take care.
I really appreciate it. Thank you.